Hey everyone, welcome back to the channel. My name is Kelly Troutman. I am a certified hand therapist. And in today's video, this is part 2 of the CMC osteoarthritis guide for therapists. So if you have not seen part 1, where I talked a little bit about how I do assessment or evaluation for patients that have this diagnosis of CMC or basal joint osteoarthritis of the base of the thumb, go ahead and check that out. I will link it in the description bar below so that you can find it. And then once you've watched that, you can come on back and we will get into part 2, which is going to be talking a little bit about treatment planning and kind of how I tend to design my treatment plan for this general broad diagnosis of CMC osteoarthritis. So just a disclaimer here, every patient is different, every thumb is different, and every therapist is different. So what I'm going to be presenting to you is not necessarily a specific guide to all treatment. It's not the one answer out there. Just keep that in mind. Know that this is not the only way to do things, and it's certainly not, I'm not trying to say this is the best way or the only way. So without further ado, let's get into it. In regards to treatment plan for CMC osteoarthritis, there are going to be 3 major topics that I kind of talk about today in this video. The first one being education. The second one being splinting, bracing, or use of other supports. And the third one being a comprehensive exercise program that you can give to patients so that they can continue on with this kind of long-term management, since we know that osteoarthritis is a degenerative disease, and so it will not cure itself, and it will continue to progress over time. So this is going to be something where you have to really get your patients on board with the fact that they are now going to have to be in the routine of doing some exercises or kind of a program, just like you would for any other body part, right? We want to maintain our mental health, our physical health, and also our hand health. So we're going to go over education first. And in my opinion, education is really the most important part of a therapy program for a patient with osteoarthritis, really for any patient, but we're focusing on CMC OA today. I think that if you can ingrain this in your patient's mind, like you literally are just hitting them over the head with it again and again and again throughout, 1 or 2 or 3, however many sessions that you're going to work with them, all of the education that you give them, handouts, give them as many things, reminders as you can, basically, without totally overwhelming them. The more they hear this information, the more it starts to become subconscious and kind of ingrained in their habits, which I think is really awesome. I like to use metaphors a lot because I think we learn through story very well. And so I tend to compare our body to like an energy balance or kind of like a bank account, and all of our activities, everything that we do throughout the day, it's like a math problem, right? Like all these little things that we do add up throughout the day, and they create more potential for pain or sprain or irritation. And so it's like, every day we wake up with a clean start, we've got a full energy balance with us. And then every little thing we do, from brushing our teeth to opening a doorknob to cooking a meal to playing sports to carrying groceries in from the store, and you see where I'm going with this, unlimited amounts of activities, and even just like the tiny finite things that we don't even think about doing, all of those activities subtract from your overall energy balance. And so if you're doing all of these things in ways that are not healthy or protective of your joints, or you're kind of overusing the joints in a certain way, you're going to end up with no energy left over. And so it's kind of like literally an addition problem, right? Like if we can figure out what things are not so important for you to keep doing the same way. Like for instance, opening an Amazon package by hand rather than, using scissors, like ripping something open, or opening a jar by hand, or I don't know, chopping things like butternut squash that are really rock hard, and you could just buy a package of already cut squash if that's, an option for you. All of these like little teeny tiny adjustments that we can make throughout the day really add up. And so it's going to leave you with more energy left over for the things that you actually want to do, like your hobbies or your interests, your leisure activities, things that you actually care about doing. So why would you waste energy on opening an Amazon package by hand, on opening a jar by hand, when you could use a tool to help you or do it a different way? So it's all about finding these workarounds for the things that you don't care about, so that you have more energy, more potential to do the things that you do want to do and that are important to you. So I really like to use that metaphor. Feel free to use it if you like it, or, please share if you have any other like examples or metaphors that you like to teach your patients. Please comment them below, because I'm always looking for like new ways. We all learn so differently, and so it's just helpful to have a lot of different options there. And so obviously a huge component of education is going to be about activity modification and joint protection, right? We want to help keep people doing activities and the things they need to do and they want to do for a longer period of time, while preserving the condition of their joints and preventing them from getting worse over time drastically, right? We know it's a progressive disease, but we can help kind of slow that progression down by targeting some of the activities. So really working with your patients, going through some common examples, asking them about specific activities or things that they've noticed, trying to figure out what these workarounds are. Can they use a tool? Can they change the environment around them so that it fits their body a little bit better? Like an ergonomic adjustment to their workstation or to their kitchen, or whatever the environment is. Teaching really good body mechanics, right? Like we all have heard, like, lift with your knees or lift with your legs and not with your back, right? That counts for every body part. If I'm going to go pick something up, I'm not going to reach way out here to get it. I'm going to move my body close to it and then bring it to me. It's just like little things like that, those little habits. Can they ask for help at the grocery store? Have them load your bags a little bit lighter, instead of carrying them out in your hands. Put them on your elbows. Maybe take more than one trip up to your house rather than loading them all on your arms at once. I think that's a huge component, and there's so much information about joint protection, activity modification. It really leans on your creativity as a therapist, and I think it's a way that you can really make the treatment very individualized and very meaningful for your patients. So take some time, ask them about their activities, or ask them if they have certain questions about things. Give them some homework, say, hey, I want you to go through your week. I want you to make a list of all the things that you can't figure out how you would modify to make it better for your joints, and bring that back to me and we'll work through it together. So that would be a good kind of homework exercise for them. The second component of education that I like to provide is about pain management. So pain is a normal part of being alive. If you're alive, you're going to have pain, and it's a good sign to know that you're still alive. It's not normal to have significant pain all of the time that isn't managed. So the goal really is to keep our pain below the threshold of excitation, or where it becomes intolerable or unbearable. So there's a lot of different, temporary relief strategies. You can talk about modalities, things like heat and ice, kind of when to use them, give patients some ideas or options, things that they can do on their own. And then things that I like to bring up as well is, this is going to sound very basic, but I think we are really doing a disservice if we do not look at the whole body. Things like stress, mindfulness, diaphragmatic breathing. Stress is something that is part of all of our lives, and it makes actually a really big difference on pain. So that's something that people need to be aware of. They need to kind of be actively working on stress management, some techniques, enjoyable things that they can do. There's so much out there about mindfulness. I don't want to go into that too much in this video, but a huge component, making sure they're getting enough sleep, right? Sleep hygiene is also huge in terms of pain. So sometimes just shifting some of those little factors can make a huge impact on somebody's pain. Obviously, I recommend cardiovascular health too, right? The typical recommendation is 30 minutes a day of some cardiovascular activity. That could just be walking around your neighborhood, riding a bike, whatever you like to do. But you need to do it 30 minutes every day ideal if it's out in the sunshine too. That's like a bonus points. And then also talking about diet, right? Like that's an important component of overall health and well-being. Our diet can certainly have effect on inflammation in the body, and it can make things feel worse or better. So talk to your patients about kind of trigger foods. Like, obviously we're not nutritionists and you can't necessarily make specific suggestions of a diet to follow, but you can make the general recommendation of, okay, you need to make sure you're getting enough macronutrients, enough micronutrients, you're eating a well-balanced diet, you're kind of trying to limit your processed foods and sugars, general advice that's good for everybody, right? And then you can also mention to them, hey, there are some foods that could be potential triggers to make your symptoms worse. So if you notice that there are certain foods that you eat and you're always feeling this pain in your joints is worse after you've eaten that food, it might be a good idea to eliminate it for a couple of weeks and then see if there's a difference. So it's not something where you can, that's not your scope of practice certainly, but you can make that recommendation and empower them to look into that on their own. Okay, moving right along. So the next component that I want to talk about is splinting, or the use of braces or supports. So I'm not going to spend a ton of time on this because there's not a one-size-fits-all recommendation that I could ever possibly make. Every patient is different, every thumb is different, and their activity demands are going to be totally different. And not every patient needs a splint either. Splints aren't always the most appropriate answer. Sometimes immobilization is kind of the worst thing you could do. So it really is just going to depend. I will say that something commonly that you want to look for is kind of the mechanics of the thumbs. If you notice that they're doing some pinching and they start to sublux or hyperextend at the MP joint, or hyperflex at the IP joint, or vice versa, right? That might be a helpful hint for you and kind of like which direction to go, where they might need a little bit of support so that they can re-educate the thumb and kind of re-educate those muscles. I think it's an important consideration that you need to make as part of your therapy program. You want to look at the patient and their activity demands especially. So is there a certain activity where they feel they really just need a little bit of extra support, or kind of positioning, or, kind of, again, that re-education component so that they're not subluxing and doing further damage to their joints? Do they need it to sleep in? Do they, what kind of is going to suit them and their lifestyle best? Would they benefit better from a soft support or a more rigid support? And then you can also consider too, like prefabricated versus custom splints too, because there's actually quite a few decent thumb spica splints out there on the market nowadays too, both hard and soft type of versions that can be helpful. And sometimes it's just like more cost effective and kind of fits patients better actually, or they feel more comfortable in it. So all of these things are really important factors, and again, not something that I can give you a one size fits all type of answer for, but just something to consider for sure. Oh, and I should also mention that actually in lieu of splints, sometimes I actually go the route of kinesio taping because I find that patients really like that taping. I love it. I think it feels amazing. And sometimes that is all they need, really, and that's something they can do themselves, and it's fairly cost effective for them as well. And with that in mind too, we'll move on to our exercise program portion. So again, not all of these exercises or these kind of ideas are going to be appropriate for every patient, so you need to really take that into consideration as the therapist. Make sure that everything you're doing is appropriate, of course, with your patients. But I'm going to go through kind of I like to kind of think of it as like a 3-part program, right, of long-term maintenance. So you're going to have part 1 is going to be soft tissue mobilization and stretching. Part 2 is kind of like a joint mobilization component, which again, take it or leave it, any of these 3 pieces, whatever you feel is appropriate for your patient. And then part 3 is the dynamic stability or re-education component. So doing some light strengthening exercises to maintain integrity of the thumb complex. So again, going into part 1, the soft tissue mobilization component, I think that this adductor muscle is a really good place to start because I find that most people tend to be very tight here. Truly all of us, because we just are on our phones all day long, and using our thumbs for a variety of tasks, lifting things, pinching. The adductor muscle is a super strong guy. We've got to get that one released. You can do mobile release on yourself with your other hand, but that can be kind of a problem for your other thumb, right? So that's where the chip clip comes in handy. So these are just those potato chip clips. These ones are nice because they've got a little refrigerator magnet. I like the shape of this one as well. But any chip clip will work. You literally just clip it on that muscle and let it sit there for, I usually recommend 2 to 5 minutes, somewhere in that range. It will release the muscle for you and kind of pull that skin up off the CMC joint where it can be really painful, and that sensory branch of the radial nerve can get a little angry or irritated. So I love this. I think this is a great, easy thing that patients can do on themselves, and the majority of people that I've had try it love it. Hopefully you can't hear, there's so much construction on my street right now, you guys, so I apologize if you can hear that. The second component, and the thing that I love, is a web space stretch. So that's going to help stretch out that adductor muscle that you've just worked to release. Both hands open, kiss the corners together like a backwards handshake. Let your hands relax, gently push the meaty part of your muscles together, and then open the fingers and the thumb. And you should feel like this really nice stretch through that web space. Again, you can teach your patients that stretch. Make sure that they're not doing anything crazy, that they're not putting too much torque or pressure on the joints, but truly getting like a stretch in the muscles. That's something that I generally like to recommend because it's something they can do anywhere. So joint mobilization, if you find that that might be appropriate, sometimes doing just a little bit of traction at the CMC joint can actually relieve some of the pain too and shift things back into the right position. I like to do it overhead because I find that if people do it on the table, they're not pulling in the right direction. There's a lot of likelihood they could hurt themselves. So if this position is accessible to them for their shoulder, have them rest their hand over their head, their thumb kind of faces down. The other hand is going to grasp the meaty part again of the muscle in the thumb. And then they're not pulling actively, they're just kind of letting their hands relax, or their arm relax. And it's like gravity does the work for you. So it's a really nice stretch, a really nice traction. And they can do that, even just holding for a few seconds, and that might be enough, really. So yeah, that's kind of like the joint traction that I'll give patients. It's very simple, again, kind of easy to remember, and they seem to be able to do that safely on their own most of the time, if they're appropriate for it. And then the third component, which I think is also really super important, is re-education, dynamic stability type of exercises. I have been doing these for a while. I actually started a few years ago with another colleague, Ashley. She taught me like a few of these exercises, and she's an amazing therapist. So thank you, Ashley, for giving me some of those concepts and ideas of where to start. And then I've further built this program up of exercises with credit to my newer coworker, Nisha, who has taught me like all of these little tennis ball exercises, which I am in love with. So I'm going to show you guys those first. And again, you can do this without the ball too, but it just gives patients like a little bit of support when they don't necessarily have great proprioception at their thumb. Holding the ball, it's like a little puppet. So you're just rolling the position of the thumb open. So you can have them do that one. The thumb stays really nice and rounded while they're doing it. You can also do a first dorsal interossei exercise where you're lifting into a peace sign, keeping the thumb again in that forward rounded position, and then applying the lateral stress on the index finger for that first dorsal interossei. So those are really great exercises with the tennis ball. And then there's also an exercise where you can have them hold their hand straight, making a C shape with their hand and their thumb, making sure it's not flat or curved in a weird way, engaging the muscles. So I like that one. It's a good re-education position. And then another one that I tend to like is actually like the, I call these like EPB lifts, having them curl the tip of the thumb and then lifting and lowering that lower component. So a lot of times you'll find that people do this and they have a really hard time when you make them do it this way. So that's a really good strengthener for that EPB little guy. I like to do the isometric tip pinch exercise. So make sure they keep a round circle. They're not losing it with flat or hyperflexed. They got to keep it like that, nice rounded. And then again, isometrically pinching them together until they feel like they're at their maximum, where it's not buckling in any direction. Anyway, those are just a few of the exercises that I like to recommend. I think they're really quick and easy, simple things that patients can kind of integrate into their daily routine. Again, it's not something that I'm saying this is like an all or none type of deal. You have to figure out what the most important thing is to your patients, what they really need, and how you can help them. And so these are just kind of some suggestions or ideas that you could use. There's been, I know, definitely a lot of research in towards this dynamic stability concept of the thumb, and so I think that is something really important to look into and kind of continue, for us to really continue building this concept, because I think it's really gonna have a big impact. We just have to kind of get the information out there and get patients to buy into it too. So hopefully, if you've made it this far, you are a true VIP. Thank you. VIP, MVP, there we go. You are truly amazing. Thank you for listening. I know that was really long and probably boring because I was just talking the whole time at you. But if you want to make it not boring, go ahead and comment below and let's like kind of get some ideas flowing out there, right? This is meant to be like a community discussion of what works best, what doesn't work, what you've found has been helpful for your patients, and let's kind of go from there. Thank you guys so much for watching. If you liked this video, give it a thumbs up, no pun intended. Subscribe to the channel if you want more of my weird humor and more hand therapy videos. And I will see you next time.